It's the Sultanate of Oman Television Live with 7 o'clock news bulletin. First, the headlines. Before His Majesty the Sultan, the Minister of Agriculture and Fisheries Wealth, Chairman of the Supreme Court and the Administrative Judicature Court, takes the oath at Al Baraka Palace. To commemorate 50th anniversary of Oman's Blaze Renaissance and the establishment of the modern Oman, Central Bank of Oman releases the 6th issue of 50 Rial banknote. The United Nations Secretary General praises the Sultanate's supportive role for peace and security efforts in Yemen. The Minister of Health announces a new 1,518 confirmed cases of COVID-19, 3 deaths and 1,016 recoveries in the Sultanate. Good evening once again, and thank you for joining us. Those were the headlines, and now the news in detail. Before His Majesty Sultan Haytham bin Tariq, His Excellency Dr. Saud bin Hamoud bin Ahmed Al Habsi, Minister of Agriculture and Fisheries Wealth, took oath in front of His Majesty. Sayyid Khalifa bin Saeed bin Khalifa Al Busaidi, Chairman of the Supreme Court. And Sheikh Al Mukhtar bin Abdullah bin Isa Al Harthi, Chairman of the Administrative Judicature Court. All of whom took oath in front of His Majesty. His Majesty Sultan Haytham bin Tariq sends a cabal of greetings to His Excellency Luis Abi Nader on his winning in the presidential elections of the Dominican Republic. To commemorate 50th anniversary of Oman's Blaze Renaissance and the establishment of the modern Oman, Central Bank of Oman released the 6th issue of 50 Rial banknotes. The new currency release came in implementation of His Majesty Sultan Haytham bin Tariq to celebrate the achievements in the Sultanate of Oman over the past 50 years and the life of the late His Majesty Sultan Qaboos for his dedication to his country and the people of Oman. The new 50 Rial banknote is green colored with the picture of the late His Majesty Sultan Qaboos bin Saeed, his year of rule, and the picture of the Central Bank on the front side, and the picture of Oman Council, Supreme Court and Minister of Finance buildings on the back side. CBO is expected to release other money notes by the end of the current year.
The Central Bank of Oman is very proud and very happy to announce the issuance of the new 50 Rial banknote as part of the new 6th series of all Omani banknotes. The rest of the banknotes will follow, inshallah, at the end of the year. The 50 note will be issued within this month of July, hopefully within the next 2 weeks. This banknote is very special. It commemorates the last 50 years of the Renaissance of the Sultanate of Oman and His Majesty the late Sultan Qaboos' contribution to that very, very significant period of Oman's history. This note is also equipped with a lot of safety features, the latest technology of those safety features to counter fraud, hopefully. We will also be working with the banks to configure the note for the ATMs and the currency deposit machines, the CDMs, very quickly. We are very happy with this issuance, and hopefully we will try to work hard to get the rest of the notes in the time that I have mentioned.
That, of course, was His Excellency Tahir bin Salim Al Amri, Chief Executive Officer of Central Bank of Oman, speaking on this occasion. His Excellency Antonio Guterres, United Nations Secretary General, commended the Sultanate of Oman for its role in supporting international peace efforts in Yemen. The United Nations Secretary General said in a meeting held with countries supporting the international initiative for a ceasefire that the international community is grateful for the pivotal role that Oman is playing to support efforts to establish security and peace in Yemen. He added the United Nations appreciates Oman's positive and important role. His Excellency said also Oman is a unique example not only in the Middle East region but also around the world, calling other countries to follow its example in supporting peace and stability in the region. Still to come in our news bulletin. A joint cooperation was established between Nizwa Hospital and the Directorate General of Scouts and Girl Guides to limit the spread of coronavirus. Once again, welcome to the news from the Sultanate of Oman television. The Minister of Health announced 1,518 new confirmed cases of COVID-19, which brings the total number registered in the Sultanate to 51,725, including 236 deaths. The Minister of Health stressed that 33,021 cases have been recovered. A national survey is due to be conducted in the Sultanate to measure the surveillance of coronavirus pandemic. More details in the following report. Number of infection due to COVID-19 is seen to keep going up in the Sultanate, as indicated by the officials, while efforts by the concerned bodies to curb the virus from spreading have been exerted from the beginning of the pandemic. Currently, the Minister of Health is working towards launching a national survey for 10 weeks for both citizens and expatriates to measure the prevalence of the coronavirus pandemic. Organized by the Directorate General of Disease Surveillance and Control, the survey will start from July 12th.
This survey is crucial at this particular time, so your participation is very, very important. Let us all be part of it for benefit of all of us.
ওমানে বসবাসরত প্রিয় বাংলাদেশি জনগণ, আপনাদের অবগতির জন্য জানানো যাচ্ছে যে আগামী 12 জুলাই থেকে 10 সপ্তাহব্যাপী অ্যান্টিবডি টেস্ট ওমানে শুরু হতে যাচ্ছে। যে কেউ এই টেস্টের জন্য সিলেক্ট হতে পারে এবং এতে ওমানি এবং বিদেশি সকলের অংশগ্রহণ প্রয়োজন। তাই আপনাদের সবার কাছে আবেদন, আপনারা কেউ এই পরীক্ষায় অংশগ্রহণ করতে পিছুপা হবেন না। আপনার এই পরীক্ষাই পরবর্তীতে ওমানকে করোনা প্রতিরোধে সাহায্য করবে। ধন্যবাদ।
कोरोना महामारी से हम पूरा विश्व आज जूझ रहा है। उस कोरोना से लड़ने के लिए नई स्ट्रेटजी का हम पर प्रयोग कर रहे हैं। इसके लिए एंटीबॉडी सर्वे बहुत ही ज़रूरी है। उस सर्वे से हम को पता चलेगा कि कोरोना की बीमारी कहाँ है, किन वर्गों में है और कितने हद तक फैली हुई है। इसके लिए मिनिस्ट्री ऑफ हेल्थ पूरा एक सर्वे कर रही है। इस सर्वे के लिए रैंडमली लोगों का सिलेक्शन किया जाएगा, उनको फ़ोन करके बुलाया जाएगा, उनके खून का सैंपल लेके उसमें जांच की जाएगी और जांच का रिज़ल्ट उन्हें पता कर दिया जाएगा। इस सर्वे से हमें आगे की रणनीति में बहुत फ़ायदा होगा। कृपया इस रणनीति के लिए इस सर्वे का आप भाग बनिए और उसका सबसे सहयोग करिए। थैंक यू वेरी मच। धन्यवाद।
Assalamu alaikum wa rahmatullahi wa barakatuh. Your participation in this survey is very essential, so please participate with us.
The research will be carried out in cooperation with the National Center for Statistics and Information at the level of all governorates and wilayats as a cross-sectional survey of different ages, including Omanis and expats, as well as collecting demographic data and blood samples to examine the antibodies of COVID-19 patients. The survey will last for a period of 10 weeks and will be in 4 stages. Now, to learn more on that, with us is Dr. Fatma Al-Yaqubia, Head of TB and Acute Respiratory Infection Section, Department of Communicable Diseases, Director General of Disease Surveillance and Control at the Ministry of Health. Dr. Fatma, good evening to you.
Good evening, Abdullah.
Thank you for joining us. Now, could you tell us more about the upcoming survey and what would an individual achieve from this survey?
Yes. The main aim of the National Sero Survey of measuring the level and the extent of spread of the infection in the community, as well as at the level of the governorate. It will also going to estimate the infection rate at the different age group, as well as the infection rate in those who have been exposed but showed no symptoms. So the main benefit at the individual level is to know their infection status. Many people actually they are calling us to be involved in this survey to get their infection status, while at the level of the country, the result is going to be utilized in planning for reopening the country and further lifting of restriction, as well as for further control of the spread of the disease.
Now, can you tell us about the procedure? How would an individual know about his participation?
Yes. So those who have been randomly chosen, either Omani or non-Omani, they are going to receive a call from one of our staff at the level of the governorate. Verbal acceptance will be taken from the participant. Then he or she is going to be instructed to visit the nearest health center, where a questionnaire is going to be filled with the help of the healthcare worker, and then a blood collection will be taken. Subsequently, the result of the blood investigation will be posted electronically to the individual.
And of course, they will come to know about the result at a later stage?
Yes, of course.
Okay.
They will be informed about the result.
Let's hope.
Hence, I would really like to encourage those who have been chosen for the participation to accept this participation, cooperate with the team, and it's like part of their national responsibility for the control of this pandemic.
Dr. Fatma, thank you very much, and let's hope that many people have come to know at this particular stage, and once they receive that particular call, they should go, of course, to the directed healthcare institutions to have their blood sample collected, and of course there are some questions that are going to be asked, and it will not take time as we came to know about it. Thank you very much once again, Dr. Fatma. That was Dr. Fatma from the Ministry of Health. In a new study released yesterday in CNN, British researchers warned that the novel coronavirus pandemic could lead to a wave of brain damage in infected patients. More in the following report.
Experts at the University College London were the latest to describe that COVID-19 could cause neurological complications, including stroke, nerve damage, and potentially fatal brain inflammation, even if the patients didn't show severe respiratory symptoms associated with the disease. The study, published in the journal Brain, examined 43 patients treated at University College London hospitals for either confirmed or suspected coronavirus from April to May. They varied in age from 16 to 85 and showed a range of mild to severe symptoms. Among these patients, researchers found 10 cases of temporary brain dysfunction and delirium, 12 cases of brain inflammation, 8 cases of strokes, and 8 cases of nerve damage. Most of the patients who showed brain inflammation were diagnosed with a specific, rare and sometimes deadly condition known as acute disseminated encephalomyelitis, ADEM. Before the pandemic, the research team in London would see about 1 ADEM patient per month. During the study period, the number rose to at least 1 a week. One woman hallucinated lions and monkeys in her house. Others reported numbness in their limbs or face, double vision, and disorientation. One severe patient was barely conscious, responding only when in pain. Researchers are still trying to figure out why exactly COVID-19 patients are developing these brain complications. The virus that causes COVID-19 was not found in the brain fluid, meaning the virus doesn't appear to directly attack the brain. One theory instead is that the complications are indirectly triggered by an immune response from the patient's body, not from the virus itself. These findings are significant for informing how doctors around the world monitor and treat patients, but they also pose new questions and challenges. For patients who are not showing severe respiratory symptoms, such as trouble with breathing, it can be difficult to identify these brain complications early enough to prevent or minimize damage. And for patients who are critically ill, their precarious health can limit how much doctors can do to investigate what is happening in their brain.
Back here in the Sultanate, the public establishment for industrial estates Madain started to apply regulations to deal with violators of the decisions of the Supreme Committee and with the developments of coronavirus pandemic in all industrial establishments investing in all industrial estates. Some 42 industrial establishments were closed at the end of the last June, and the fine amounts collected from violators will be transferred regularly to the account allocated to combat coronavirus pandemic. The companies and factories are committed to take all measures that protect the public health and notify all workers to adhere to all precautionary measures. And in the governorate of Dakhliya Nizwa Hospital, the Director General of Scouts and Girl Guides established a joint initiative to enhance efforts being made to combat the spread of coronavirus. More details in the following report.
Within the framework of supporting the efforts exerted to curb COVID-19 pandemic, Nizwa Hospital, in collaboration with the Director General of Scouts and Girl Guides, established a joint initiative to provide volunteer scouts to help in maintaining the precautionary measures.
In order to save the technical staffs to do their job during this period, we have created a partnership with the Directorate General of Scouts and Girl Guidance in the Ministry of Education in order to provide us with human resources to cover these points. I would like really to appreciate what they have done. Immediately after we sat with them, within less than 2 days, the volunteers are in their position doing their job very efficiently.
Besides checking the temperatures of the hospital staff and visitors at the checkpoints, the scouts also give instructions related to maintaining physical distancing and wearing masks.
As part of the Nizwa Hospital responsibilities and action steps in order to deal with the COVID-19 pandemics, ARI checkpoints has been created at all entrances of the hospital. These points are aiming for 2 main responsibilities. The first one is to detect earlier those who are coming to the hospital if they are getting any symptom or sign indicating that they are infected with the coronavirus. And the second aim is to give them the guide and education about how to implement the precautions and other measures which are well known for the COVID-19.
Such voluntary tasks conducted by the Scouts at Nizwa Hospital will ensure the flow and efficiency of the compliance with the preventive measures.
This joint initiative reflects the ongoing national efforts towards combating the spread of coronavirus. From Nizwa Hospital, Salih Bakhalfan al-Rahbi, Al-Dakhiliya Governorate.
You're watching the Sultanate of Oman television, and to end this news bulletin, here are the main points once again. Before His Majesty the Sultan, the Minister of Agriculture and Fisheries Wealth, Chairman of the Supreme Court and the Administrative Judicature Court takes the oath at Al Baraka Palace. To commemorate 50th anniversary of Oman's Blaze Renaissance and the establishment of the modern Oman, Central Bank of Oman releases the 6th issue of 50 Rial banknote. The United Nations Secretary General praises the Sultanate's supportive role for peace and security efforts in Yemen. And the Ministry of Health announces a new 1,518 confirmed cases of COVID-19, 3 deaths and 1,016 recoveries in the Sultanate. And that's the end of tonight's news bulletin. Remember, on the 12th of July, the survey will start, and the Ministry of Health is expecting to see you participating in this survey. Good night.
جميل عمان، والأجمل تجمعاتنا في مثل هذه الأماكن. لكن خليني أذكركم وأذكر نفسي بأنه في مثل هذه الظروف يفضل أن نجلس في البيت. بس للأسف بالرغم من التعليمات الصادرة من كل الجهات المعنية، إلا أنه لا زلنا نشوف بعض الناس ترتاد الأماكن العامة مع أطفالها ومع العائلات، وهذا يعرضهم للخطر. بنتجمع، لكن الآن